Hello, everyone. We warmly welcome you all to the latest podcast by the Bandaranaike Academy for Leadership and Public Policy. So today we'll be discussing about a topic of timely importance. We live in an era where we talk a lot about the health and well-being of our citizens, of our communities, and we also talk about gaining access to good quality healthcare services. And also we are concerned about the legal and policy implications of the health sector. So, as Sri Lanka's first and premier institution on public policy and leadership, the Bandaranaike Academy for Leadership and Public Policy is committed to educate and raise awareness on policy related issues as well as issues related to leadership and governance. So, today we'll be discussing an important aspect of the health policy of Sri Lanka. So today we'll be discussing about medical ethics, negligence, and beyond. So let me introduce you to the two resource persons. Today we have with us Professor Susirith Mendis, who's Emeritus Professor of Medicine and former Vice Chancellor of the University of Ruhuna. And we also have Dr. Nishara Mendis, who's currently the Director of Research of the Bandaranaike Center for International Studies. So they'll be both today discussing about medical ethics, negligence, and the way forward. Uh, so let me first commence the discussion by asking Professor Mendis. Professor, how would you like to look at issues of health policy from a medical ethics perspective?
Yeah, I would like to see the health policy developed according to certain basic principles of medical ethics, on which everything with relating to medical ethics is based on. And there are these four pillars. The four are the concept of beneficence, non-maleficence, autonomy, and justice. So ultimately, when we look at health policy, we have to look at this within those dimensions. So, for example, I would like to say that there are certain moral principles in which we have to work through, and those moral principles have to ensure fairness, justice, respect for individuals as well as communities. And when we evolve health policies, these are the main dimensions through which we will try to evolve and formulate and establish health policies in any country.
Thank you very much, Professor. Now, moving on to the next question. When it comes to health policies and medical ethics, so can there be conflicts? In your experience, can there be conflicts or dilemmas in medical ethical values when health policies are being formulated?
Yes, there are always, when it comes to health, medicine, there are ethical dimensions which are conflicting purely because we don't have definitive, clear cut, right and wrong answers. So, therefore, there is always this issue how to balance and compare between these different issues, and sometimes you face, in fact, policy dilemmas. To take a very clear example, just to illustrate the point, is for example, would you invest funding and establish a policy where you are trying to formulate a policy, for example, on lactation management training for midwives nationally? And there has to be certain investment, and that investment must be behind it. We should have a certain policy established at the state level. Then, would you invest on that, or on the other hand, invest probably a equal amount or even more on the purchase of a MRI scanner for a district general hospital? So you have to take a decision on this. The investment might be more for a scanner than a national program for midwife training. And then that has to be decided on, and that would be a dilemma for the state, and particularly in a country like Sri Lanka, where the Ministry of Health is a monolithic organization which controls almost everything with regard to health in the country. So that kind of is a classic example that I can think of. And all the time when it comes to resource allocation, whether it's physical or human, this dilemma continues to occur. That's a classic example, but there are so many in this area where you can say are the conflicts and dilemmas that one would face in terms of health policy.
So thank you very much, Professor. Moving on to the next question. Now you spoke about balancing competing ethical values when it comes to formulating health policies. So why should there be a need to balance these competing ethical values when formulating health policies?
Yeah, no, this again comes out of this idea that I just enunciated, that how do you balance out between individual needs, health needs, versus public health needs or community health needs? And these are the comparison that I took when you look at funding and policy in that situation. So, how do we look at cost effectiveness in terms of the greater need for health for the people of Sri Lanka? In that situation, you have to ensure that the larger numbers need to be considered compared with individual health. For example, as I go back to this issue of, say, a scanner, an MRI scanner might be important and useful in saving of individual lives, a few. But on the other hand, if you invest that amount and you have a health policy which looks at the larger picture, the community picture, the population picture, you are looking at a situation where that investment is going to probably ultimately save the lives of large numbers of people. And that is where we come into this issue of justice and equity. So when you talk about justice, it is not the justice of restorative or retributive justice, but we are here talking about distributive justice. Justice where you allocate funding to a more distributive format. So I need to mention that at this outset.
Thank you very much for that vibrant explanation, Professor. So, when it comes to formulating health policies, we cannot simply ignore the role played by medical professional bodies. So, my next question to you, Professor, is what type of a role can these medical professional bodies play when formulating health policies and further developing these policies?
Yes, in terms of health personnel, the quality and standards of health personnel is determined by the Sri Lanka Medical Council. But when it comes to determining national health policies, I think a greater role will be played by a national medical organization like the Sri Lanka Medical Association. And also, there's a large number of colleges for each and every specialty. For example, cardiologists, anesthesiologists, general medicine, pediatrics, and now we have ophthalmology. So there are these colleges, and these colleges are focusing on their specialty. But when you're trying to formulate a national policy, it must have an overall cover of all these aspects of uh, national health, individual and community health. For example, if you want to think of national visual or vision for 2020 that we had some time ago, that needs a specific policy, and for that to be formulated, for example, the College of Ophthalmologists must be brought in, just as an example. So that is an area that where these colleges, the specialist bodies, can participate in the development of national health policies.
So, my last question to you, Professor. Now, how can these medical professional bodies ensure cooperation and support to the state agencies in developing health policies? What type of a role can they play in that regard, in cooperating with the state agencies, with the government?
Yes, when it comes to this, who is going to be proactive? Who is going to be reactive is the issue. My view is that both the state that is the Ministry of Health, as well as the colleges and the professional bodies, have to take a proactive role. For example, the ministry must initiate programs and invite these professional bodies for regular discussions, regular deliberations in policy formulation. At the same time, the professional bodies must take it upon themselves that they have a role to play in the development of national policy, and therefore they must ensure that they approach the state, approach the ministries, relevant ministries, to offer their services, offer their expertise, offer their advice in the formation of national policy. So, with this regard, even with regard to medical research, health research, there are so many bodies like the National Health Research Council, the National Research Council, the National NRC, National Research Fund, and so on, who are funding research. Now, they must also have a health policy oriented priorities in formulating what is the more important research, what is the greater uh, good that can be served by researching in what areas. So, that is another area that these colleges and the ministry must cooperate and participate to ensure that we have a worthwhile national policy in Sri Lanka.
Thank you so much, Professor, for your explanations on the contributions of medical professional bodies as well as the ethical dilemmas in developing health policies and what needs to be improved in that area. So now I would like to discuss a little bit more about the legal aspect of this whole issue. So I would like to raise a few questions to Dr. Nishara Mendis in that regard. So, Dr. Mendis, now coming from a legal background, what is your perspective on health law and policy formulation?
To connect with some of the things that were said before, once there are consultations and participation in policy creation, you do get a Sri Lankan national policy on health. And we also have under that national policy various sectoral focuses. And if you look at the current national health policy and national master plan, there is a framework, I think, of almost 30 odd sectoral policies as well, ranging from national medicinal drugs policy, national policy on health information, immunization policy, and so on. Now, these set forward the state's kind of priorities and the methods and the goals. But sometimes there are situations in which it is not merely the sort of goal setting that would be focused on, but sort of a little bit more on regulation. So there are certain instances where there is not an issue of sort of self-regulation or following certain guidelines, but there is an enforcement that is required. Now, in those kind of situations, the Sri Lankan legal system then incorporates these ethics and values relating to health policy. It could be relating to other sort of broader issues of individual or public good into laws. And if you look at the domestic legal system, that is the Sri Lankan legal system, there are a number of different, again, focus areas, maybe you can call them, where it directly affects or has an impact on health. Now, these days there are a lot of things being discussed in public about certain procedural issues which are affecting the health system. Now, if you look at it from a legal perspective, that is very much in the area of administrative law, the use and abuse of discretion in decision making, the importance of proper procurement procedure. So, procedural laws play an important part in making sure that the policies are actually implemented properly. And then related to those procedural aspects, you also might have some white collar crime, including financial crime, and the criminal law could also come in, where at a certain point it would be seen that, let's say, certain poor decision making might have criminal consequences. Now, other than the area of procedural law and criminal law, you also have private law aspects where private parties can sort of sue each other in the law, and the law of delict becomes very important there. That is where we find the issue of medical negligence, and that applies to health professionals as well as to, it could apply to hospitals as well for hospital liability, though that is much rarer in Sri Lanka. And here, some of the issues that were mentioned earlier about beneficence, non-maleficence, patient autonomy, and includes things like patient informed consent and so on. When those ethics or like good practices are not followed, it could result in legal steps that could be taken by private parties against each other. So basically, the patient could have a right, or the patient's family could have a right to sue in courts. It is not very common in Sri Lanka, but it does happen. We do have the law of delict under our sort of influence from Roman Dutch law, where medical negligence is then seen into, and it is a legal enforcement of the medical professional's duty of care to the patient. And there is also, in addition, I would mention, although we don't have a right to health in the constitution of Sri Lanka, it is possible that health could be protected under Article 12, which relates to equality and equal protection of the law. And in addition to that, there could be also various other related laws, for example, consumer protection laws, which do have an impact on public health as well. And all of these are in areas where policy wise or self regulation is considered insufficient, and Parliament therefore decides to step in.
So, Doctor, now is there anything something beyond domestic law and policy that we need to be aware of when we are dealing with health related issues?
Yes, because there are a lot of things that are happening at the international level with regard to health policy formulation, as well as, in a sense, setting standards. So we should be aware of this because there is a certain degree of harmonization that is sometimes happening in the world, in between different countries, so that there are common health policies across different countries. Now, this international standard setting can range from various specific areas, such as having an overall right to health approach or a human rights approach. There are specific topics like tobacco regulation or pandemic response, and even something that doesn't seem to be directly, a health topic, such as international trade law, because it regulates goods, services, and intellectual property protection, can affect medical goods crossing borders, it can affect health services crossing borders, and it can also affect things like intellectual property relating to medicines or medical inventions. So, all of these, there would be international norms and standards, and then the states who accede or ratify to those conventions and agreements, then they promise to implement this in the domestic system. So, if you look at these aspects, states through their representatives, the government representatives, they agree to certain standards. They agree to then implement those standards in Sri Lanka. I would also add there are some specific issues that, let's say, now a little bit, attention in the public sphere, such as protection of healthcare workers in armed conflicts, which comes under the Geneva Conventions, and the right to a healthy environment, which comes under environmental laws and policies, which interact with, of course, our topic on health policies. I could go ahead, Ms. Shani, and talk a little bit more about the United Nations and other agencies that are involved in this formulation. So, if I go ahead on that a
Sure,
little
sure.
bit.
Yes, you can. Please elaborate a little bit more on
Yeah,
the role of these international organizations in
yeah,
contributing to these type of
yeah.
engagements.
So, various United Nations organizations, particularly the World Health Organization, but also other non UN international bodies, get together sometimes with states and with non state actors, and they set agendas to develop policies, they influence practices, and they formulate regulations, texts of regulations and laws, And what is really important here is they sort of form a common conceptual language to address health policy. So if you are in Sri Lanka and you want to study health policy, it is good to look at these documents because of the common conceptual language that cuts across these international documents and gets adopted into local settings. Now, the sources of these agendas, although I say it is at the international level, the sources of these agendas can actually come from national policy planners, from health professionals at the domestic level, from professional associations, and various NGOs, including patients' rights organizations, and so on. I can give a specific example of this, a successful example. We can look at tobacco control. There is a WHO Framework Convention on Tobacco Control, and this was initiated by a small group of academics at some of their research forums. These academics got together with anti-tobacco activists, and they proposed this at a world conference on tobacco and health in 1994. This was quite soon picked up by the World Health Assembly. So the following year, the World Health Assembly of the WHO, they adopted a resolution that they must take action on developing an international convention with the support of governments and with the input of non-governmental organizations. So Sri Lanka also participated in this process and then ratified the Framework Convention on Tobacco Control in 2003. And they have our Ministry of Health has gone on to implement some comprehensive tobacco control policies and regulations and laws. So this is a good example or like a happy example. But there are also sometimes where the different international standards do not align and they conflict. And if we continue on the tobacco example, we have examples of where large tobacco companies took national policies to court in both the domestic setting as well as the international dispute settlement systems to sort of fight against the international obligation for tobacco labeling. Like we see it now implemented in Sri Lanka because we can see that cigarette cases have this particular warnings and labels. But it was a bit of a sort of clash between certain trade rules and the health rules. So it is not always that these international laws are necessarily aligned. Now, in another final point I would like to make is I mentioned earlier how we do not have a right to health in the Sri Lankan constitution. Nevertheless, the Sri Lankan national health policy uses the same language of equity, accessibility, quality, and affordability that is used in the International Covenant on Economic, Social, and Cultural Rights. So, coming back to that point, when there is a sort of vague set of values or ethics, we can see sometimes that when they get transformed into policy documents or get transformed into national policy or national law or international law, then there is a bit of a strength behind that idea and it sort of affirms that idea.
So thank you very much, Doctor. Now we've come to the end of a very productive discussion. My final question to both of
Mm.
you is now we spoke about the role played by medical professionals,
Mm.
the state,
Mm.
government agencies, international organizations, as well as the contributions of legal regimes in formulating and developing health policies. But as you both know, that we cannot take this to the next stage without the active involvement of the public. So, in your opinion, what type of programs can be initiated? What type of strategies can be adopted to raise awareness and get the public more proactively involved in this process?
Yeah, just to give my point of view on that, I think increasingly, because of the internet, because of the information that's available on health, medicines, and so on, and even treatments, the general public is now a much more knowledgeable public than they were. And then they have their own continuing level of serious discussion in the social media about issues of public health, issues of health policy, what are the priorities that should be there for a good health policy, and this is being debated in public. And therefore, in my view, other than the non governmental organizations that are related to health who are discussing these issues, there is an overall great awareness of what health means to each individual and collectively to communities. And also, this has a impact or coercive impact on governments and ministries of health in deciding what probably should be the health policies as they evolve and continue to generate more and more concern in establishing a more people friendly health policy for the country. That is my personal view.
Thank you. Now I would like to request Dr. Nishara to express her opinion on this topic.
Yes, I also agree with that. I think people are getting very involved, and I also don't think it's necessarily a new thing, although social media today plays a particular role. Because if we even look at something like the national HIV/AIDS policy, if we go back to 30, 40 years ago, this was not a topic that people even wanted to discuss. It was ordinary citizens who actually brought attention to this, both in the sense of bringing it up as a policy issue and even taking up cases in the courts for the benefit of the public in general. So I think that we have to acknowledge that an extremely important role has been played by ordinary citizens, and that it should continue to be acknowledged that they play an important role, because when it comes to the whole area of developing health policy, there's a lot of progressive achievement that we yet have to achieve. And for that, I think the more there is involvement of anyone in this debate, in debating these issues, in developing the discourse, and I would also say in using the language of ethics, using the language that has come into policy and law, because there are some terms that would help people. I think education on those terms and awareness of that will actually add to a sort of a better and more maybe a better formulated public discourse, as well as how it could impact on governments and whoever is formulating the policies. So I think maybe spreading more awareness on what kind of terminology we should be using, and what kind of concepts have already been created could add to that discussion.
So thank you so much. We've come to the end of a very productive discussion on a topic of contemporary importance, an issue that affects not just one or two people but the entire community, health policy, medical ethics, negligence, and beyond. So I would like to thank our two resource persons, Professor Susirith Mendis and Dr. Nishara Mendis, for their valuable contributions in educating the public on a topic of timely importance. So, ladies and gentlemen, would like to wrap up today's podcast, and please stay tuned with us for more podcasts in the coming months. Thank you so much.